In this presentation, I will be discussing the use of neurofeedback training and its effectiveness in young children. I will also give a brief discussion about the stimulant medication prescribed for ADHD versus neurofeedback training. What is ADHD? ADHD is a developmental mental disorder characterized by persistent symptoms of inattention or inattention in combination with hyperactivity and impulsivity behaviors. The severity of these symptoms can impair a child's ability to effectively function. The purpose of neurofeedback training. Neurofeedback is also known as EEG biofeedback, which is designed to help an individual with ADHD learn to alter their EEG pattern to a consistent, focused, attentive state. This is done by collecting EEG data from individuals as they focus on the stimuli present on the computer screen. The ability to control the stimuli, for example, keeping the smile on a smiley face, is contingent on maintaining an EEG state consistent with focused attention. Once a patient becomes aware of his or her focus levels during the sessions, they become better aware of how to use their brain in order to focus. What happens during the training session? During the training session, students sit in a room where electrodes are placed on the child's head to record EEG activity. In turn, the EEG is generated by a specific type of activity from the brain waves, which play a big part in the child's attentiveness, initially because the frequency of those brain waves are responsible for the cognitive performance in the child. There have been many stories about the use of the medications and neurofeedback training, and many have found that both treatments have caused significant improvements in a child's academic performance. Now I will talk about the stimulant medication versus the neurofeedback training. The prescribed stimulant, also known as Concerta, remains the most widely used intervention for ADHD. In recent studies, they have found that its limitations are the side effects that occur after taking the medication. Neurofeedback was actually used as an alternative treatment because of the side effects children got from the medications. Financially, some parents prefer to get the medications rather than paying for the neurofeedback sessions. As you can see, the chart here is designed to show the levels of each treatment before and after they were given. The first part gives you a percentage of the symptoms that were seen in the students before the treatment began. The second part shows a decrease in the symptoms after the students completed the experiment. In the next chart, as you can see, there were no significant changes seen between the use of both treatments in the students. Both control groups experienced the same levels of improvements from both treatments. All levels of the symptoms were lowered, and the results were seen by computerized test assessments, which were taken by the patients in the study.